All right, everyone. Thank you very much for attending this conference. I want to first thank Stephen and all the people here responsible at The Real Truth About Health for inviting me back. This is year four, and I've given at least full lectures and about six panel presentations. So today I'm going to take it a little bit further. I'm going to be building upon my previous lectures, and I'll kind of reference every once in a while hey, go back to this previous lecture that I gave because I want to add more information. As most people know, I'm a strong educator and I like to promote and empower my patients with knowledge. And so the first thing today I'm going to talk about, and I actually changed my lecture title. It's not just 3 essential tests. I'm going to do a variety of tests. Some of the things that were conventional that your doctor should order, but may not. And also the differences in how different doctors from a conventional MD to a naturopath or chiropractor might have their limitations on both sides, as well as we're going to look at then what other tests that I do and I recommend in my evaluation that will help you obtain optimum health. So my name again is Dr. Pai, and I practice integrative medicine. Now, what integrative medicine is just real quick in terms of a lot of people use this term holistic and integrative, but integrative medicine is the combination. It's actually for those people who are formally trained, and I'm one of the first formally trained physicians in the United States and in integrative medicine, doing a fellowship with Andrew Weil almost now 24 years ago. It's a combination of everything. So we're all conventional MDs. I'm a family medicine physician MD trained all the way up to residency and everything like that. But then we do a fellowship training, and in that fellowship training, then later on we incorporate functional medicine, which I'm certified in. There's regenerative medicine, that's part of it. Naturopathic. I'm actually certified in plant-based nutrition as well as herbal medicine, anti-aging, mind-body medicine, lifestyle medicine, which is a big thing right now, which is really talking about plant diets and stress reduction and lifestyle. It's all incorporated in integrative medicine. And the other aspect that we have in our training is that we're trained in also a lot of traditional medicines, which you will see how I practice is that we use a lot of like Ayurvedic medicine and Chinese medicine. These are traditional medicines that have been around for thousands of years, and they still have this ancient wisdom that we use today in terms of when it comes to certain types of practices. Acupuncture, yoga, movement therapies, these are all the different things that we encompass and we incorporate in how we evaluate. So when I talk today about different tests, and you can see like, well, sometimes I'm critical on the MD, sometimes I'm critical on the other side of the aisle. It's because once you have this total encompassing approach, then the subtle nuances of where certain areas there's lacking of information or experience or education or knowledge. Doesn't mean that they're wrong or doesn't mean that they're right necessarily. It just means that we're trying to pull a fuller comprehensive approach to bringing people to their health. And you can look at more of my background at senjevani.net. So let's start off with the reality of medical care in the United States. Right now, unfortunately, if you can go to your doctor, if you have time to even get into an appointment, sometimes it's now 6 months to 12 months to get into a primary or a specialist, depending on where you live. Now, the more rural you live, the worse it is. So places like where I live, I'm in Albuquerque, New Mexico, it can take on average about 9 months to get in to see a primary, and sometimes a little bit longer to see a specialist. So we're really lucky. What we're trying to do is we're trying to help people really prevent themselves from going to the hospital. We're trying to get them healthier because right now our system is kind of failing everybody. And even if you have insurance and you have a good hospital near you, it still doesn't adequately prevent you from having the problem. It just may be able to address that problem a little bit better than other places. But right now, we definitely want to check your weight, but a lot of places don't check weight anymore, right? That's becoming a controversial issue with even having someone stand on the scale. Checking your blood pressure. A lot of places now, the machines are not working really well. We now don't even have cuffs sometimes the right size. And a lot of places that are doing it correctly, they're actually going back to actually doing old-fashioned blood pressure, actually measuring it with a stethoscope and your own kit. But the average right now time that is spent in a provider's office is between 9 and 16 minutes. The average in the country is about 12 minutes, 10 to 12 minutes that you spend with the doctor in that practice. So really, how can we learn about a patient in 10 minutes? And that's, including a little bit of time, like again, blending your blood pressure, getting all these things, getting into the room, sitting down, trying to even just have a little bit of a rapport with your patient. I spend, with my initial patients 2 to 3 hours because we're reviewing their labs, we're reviewing their charts, we're reviewing their medications and supplements and going through their history deep and having them fill out a lot of online information before they even the visit, because then that also helps them explore their own history. But right now, unfortunately, with the lack of actually providers now in healthcare, especially especially post-pandemic, most visits are now just with a physician assistant or a nurse. We're not even getting enough nurse practitioners in. So there's a little bit of lack where people wait a long time. They get to see a provider, but that provider, although they're not bad, they may not have the full experience of what the patient actually needs to have their answers answered adequately. The cost right now, the premiums just for a family of four minimally is about $31,000 a year, which is really expensive. But that's just the cost of the premium. That's not looking at that they're getting better health care. So there's an offset where the most people are spending a predominant amount of their money, of their income, just to have the health insurance, but the health insurance is not actually insuring their health. And the worst thing that's happening now since the last several years and since social media, it is the number one source of medical information right now. When the internet came out, it was like, okay, people would have like a WebMD kind of website where they can get some information. And I'm all about patients researching and understanding that there's second opinions and there's other options available that their doctor or the provider may not have explained to them in that 10 minutes. But Google searches became the we call it the Dr. Google now. But then what's superseded that now is Facebook, and Instagram is now where people were getting their information. And now, unfortunately, the number one source of information that people are getting their medical information is from TikTok videos. So this is like a disconnect because we can't get that information from our doctor. So people are going to look for, in a short, maybe 20, 15-second video, something about their health. So today I'm going to teach you about certain tests and certain things that can empower you to work with your provider. Or if you'd like to see me, I'll be happy to help you get better. Now, what did all this expense bring us? We spent $4.5 trillion in last year in healthcare, right? It's 18% of our gross domestic product. We spent $633 billion on prescription drugs, but that didn't improve our health. In fact, we ranked 16 at the bottom of 16 top democracies from death from all causes. So like infant mortality, teenage pregnancy, drug-related deaths, obesity, diabetes, heart disease, lung disease, disability. We're at the bottom of the top 16 democracies from death from all these causes. So our children, for example, infant mortality die more than 16 other countries ahead of us that are supposed to be, democratic countries. We're ranking 34 out of 35 countries in life expectancy. And in fact, our life expectancy decreased since COVID, right? So we're actually living less even though we're spending more. And we rank 46 out of 48 countries in overall health outcomes from all disease. So if you live anywhere there's a tertiary care hospital, yeah, for a gunshot wound and a car accident, fantastic. We're the best place to live. But outside of that emergency room, again, 46 countries, we're out of 48 countries. That's where we're ranking. And other countries that are ahead of us is like Iran, Turkey, and Dominican Republic. So we have to understand that although we think we're number one, we're spending the number one amount of money, but we're not getting the bang for your buck. So what I'm going to help you today is how to look for certain tests, how to ask for certain tests. And once you have this knowledge, your job is to actually help you find and explain to your provider in that short period of time with your history, because once you're the only one who knows your symptoms and the doctors may not be able to ask all the questions. So the more that you're able to kind of navigate, like this might be some place that I need to tell my doctor more that I have symptoms, or this is a place that I'm more concerned about because I am having symptoms, then that will actually improve your overall health outcome, because you just can't be relying on the physician or the practitioner of one kind to just answer your questions or to provide you answers without actually a quick 10-minute visit. So the conventional tests by doctors are usually this. They check your cholesterol. Now, the problem is with that is that they only do that after a certain age. I check everybody's cholesterol, no matter how old they are, right? Because we now see with the standard American diet that even people 18 and above have super high lipid problems, right? And we're seeing more and more people with cardiovascular diseases earlier in life. There's a lot of doctors and cardiologists in these programs, and they can go into that all in detail and explain that to you. Also, when we look at blood sugar, they might just check a fasting sugar, but they're not checking their long-term average blood sugar. So unless you're diabetic, they might screen your thyroid, but they don't look at the full thyroid hormone. So a lot of people feel like, well, gosh, I have some of these symptoms, but my doctor says my TSH is normal, thyroid stimulating hormone. I'll go into more detail in a minute. They check your metabolic function, complete metabolic panel at CMP, but sometimes only if you have medication issues or if you're on blood pressure medications or you have other issues with maybe kidney or liver. But we like to look at the function of everybody because we can see earlier changes of your kidney function, and we can improve that with just diet and lifestyle. Sometimes we can use even natural therapies to improve those functions. They might check a CBC, a complete blood count, if you're sick or if you have anemia. They might check a vitamin D only if you have osteoporosis. And they might check some inflammatory markers like CRP or things like uric acid for gout symptoms or ANA and ESR only if you're symptomatic or only after you've seen a rheumatologist and you've been formally diagnosed. But the conventional tests that I recommend, right? And again, these are the same things, but I'm going to explain a little bit of why we would want it done. And they don't have to be done every single visit, but doing it annually, or more importantly, when patient presents with symptoms, or if you have symptoms, then these are the things that you should probably request, or I would recommend that you speak to your doctor or your provider. So when we look at with a CBC with a differential, we want to check your white blood cells because a lot of people, we know that when the CBC and the WBCs particularly are elevated, there's some kind of, infection. Okay, I got a respiratory infection, I got a sinus infection, I got a urinary tract infection, for example. But we also want to look at the flip side. If it's low, then we also know that there's immune problems, right? There's also like a low ability for the body to start fighting and fixing infections. And we're starting to see a lot of people with lower immune system functioning. Their WBCs are lower than the norm, right? And this is due to diet, lifestyle, especially environmental toxicities. Anemia is another issue, right? Anemia is a huge problem. And it's not just in pregnancy and women with menstrual cycles and stuff like this, but we're seeing a lot of issues with iron deficiency, with malabsorption, with risk of GI issues in men and women. And also as we get older, B12 and folic acid issues as well. And also we want to look at clotting issues. A lot of people are taking aspirin daily, which, we don't recommend anymore. For prevention of primary heart attack, it doesn't do that. So people have more GI bleeds than actually having the prevention of the primary heart attack. But looking at their platelets and looking at understanding, like, because a lot of people, if you start having bruising on your arms or skins, you should be looking at that as well. Complete metabolic panels, looking at your electrolytes, your liver and kidney function. So if you're someone who's having issues with dehydration or blood pressure issues or blood sugar problems, or you drink a lot of alcohol or take drugs like statins or metformin or anything else that could be very strong on the liver, we want to have that checked regularly. And that's what's on the insert of the drug. That's what's recommended in the guidelines, but hardly ever it gets screened unless people start presenting with symptoms. And again, we're not anti-pharmaceuticals in integrative medicine. We're actually anti-side effects. So we just always want to be making sure that the drugs are working for the patient and not harming the patient. Same thing with natural therapies as well. When people are looking for the thyroid stimulating hormone, TSH, that's just a general screening of where your metabolism is working, kind of the thermostat. But we want to check your free T3, your free T4. How is your hormones of your thyroid being converted, your T4 to T3, peripheral and central? And we're looking at, if there's someone has a conversion problem. Also looking at your antibodies, whether you have Hashimoto's thyroiditis, TPO antibodies, thyroglobulin antibodies. We'll talk about lipids in a minute. We'll talk about the A1C, fasting insulin, vitamin D, checking some aspects of HRCRP or uric acid, homocysteine, ESR, ANA. These are some non-specific but helpful inflammatory markers. And then I also look at with patients that are on bioidentical hormones, and we see too many people now taking too much bioidentical hormones now from getting pellets and creams too high, or they're going through menopause. We want to check their free and total testosterone, their estrogen, their progesterone, and then in men for screening if they are having prostate symptoms of PSA, but more importantly, a percent free PSA, so then we can further delineate risk. So it's not just that the PSA is up and we're concerned. We can actually look at maybe they're just having enlarged prostate and there's still a low risk of cancer. So these are the general kind of conventional primary care screening that I would recommend for my patients. Now, when it comes to screening tests that the regular doctors and also integrative medicine asks for prevention of just screening for cancer, we're looking at women getting mammograms, whether it's a 3D or a 4D or a QT scan. Some people even go for thermograms. But if any of those things, even a physical exam, shows something that might be hot or suspicious, then they still would have to go get a mammogram or a 3D or 4D or QT scan if they're doing a thermogram, for example. Colonoscopies are very, very important. Now, a lot of people, as you know, the rate of colon cancer, which is now the #2 cause of cancer in both men and women in the United States, right? And cancer is now 1 in 2 men and 1 in 3 women, or vice versa, maybe now 1 in 2 in both men and women. That's what the newest latest data is saying, in their lifetime. So we want to do colonoscopies, and the screening of the colonoscopy actually has been lowered. It's been, I believe it now starts at the age of 40. In our practice, what we've seen is that since a lot of people are doing extreme diets, right? Paleo, keto, and more importantly, the trendy carnivore diet, again, another iteration of a high animal protein, low carbohydrate diet, is that we've had patients under 35 coming in with stage 3 colon cancer, stage 4 colon cancer. And this is now becoming a common thing. Every few months, we'll have a patient coming in because they've lost weight, they've done some kind of trendy diet, and not understanding the full ramifications of why that's wrong. Cologuard's another test that people can do for screening for colon cancer, but the problem is if your Cologuard's negative, which we want it to be, that means that there's less risk of having cancer, but we're missing other pathologies like colon polyps, diverticulosis, diverticulitis, inflammatory conditions of the bowel, for example. And when we do a colonoscopy, if they see a polyp, which is just a response of inflammation over time, that when they remove that polyp, they're removing the potential of a place that could potentially have a cancer 5, 10, 15 years down the line. So the Cologuard can be helpful at screening, but the problem is it's not looking at the earlier stages of pathology, which a colonoscopy can do. Chest X-rays for those people who are lungers, they have more issues of bronchitis or smoking or other kind of respiratory conditions. Prostate exams and Pap smears for women. These are all things that we recommend. But what I go further and I offer to my patients is, well, especially if someone has a strong risk factor, right? So maybe they are a smoker, maybe they have smoking all their life, and their chest X-ray is normal, or they're not presenting with any symptoms and they can't even get a chest x-ray. Or they have other issues like with prostate or lung, or there's a family history of ovarian cancer, something that's very hard to screen. Now there's abilities to have testing where you can do a blood test and they can screen, zero screening tests, not 100%, but with high sensitivity and specificity for cancers, they can screen for 50 different types of cancer, right, from a blood test. Now, there's a lot of people right now, you can see it in Hollywood, a lot of people are getting these big imaging scans, like you get this full body CT scan, you can spend $3,000 to $5,000 on a scan, but those things only are about 2% effective at even picking up something in an asymptomatic patient. So it's a lot of exposure to unnecessary radiation, and most of the associations in medicine don't really agree with that kind of screening so far because it hasn't panned out to be effective or really truly reducing it. What we like to look at is that if you have elevated circulating tumor cells or cell-free DNA, these are things that we can actually pinpoint in certain parts of the body. So we can see a breast CTC, so circulating tumor cells, before a mammogram would even show it, or a thermogram, or any other kind of screening technology. And these are things where, because then we can start changing the diet, we can start changing the person's lifestyle and help reduce that risk of it getting worse. Now, if it's positive, then we can say, hey, we need to do a scan, or hey, you got elevated circulating tumor cells from your colon cells. Then we need to say, you need to go see a GI doctor and have a colonoscopy. We need to actually physically go take a look, because that might lead them to actually go do these screenings, because a lot of people just tend not to want to do the screening at all. If someone does have cancer, however, there is a variety of blood tests that is covered by the patient's insurance, CEA, CA125, CA2729, and CA153. They're not perfect. They're not exactly, always correct, but these are just general screening markers for breast cancer and abdominal cancers and just GI growth of types of cancers that, if you have cancer, you should be asking your doctors to actually get some of these tests depending on your cancer, because these are some things in addition to the scans and all the other imaging and all the other blood work and the cancer markers, is that we can follow someone, are they responding to treatment or not? And we can also see earlier, reduction, or unfortunately, sometimes there's resistance, and we can see these numbers start to go up before we even get a scan. And also with the blood test now is that if someone is diagnosed with a cancer, say breast cancer or colon cancer or prostate cancer, we can actually look at like circulating tumor associated cells, and they actually then can test against, about dozens of different types of conventional chemotherapies and also natural therapies against the patient's own cancer cells. So it's not just like everybody gets the same thing. It's like, how do you respond? Similar to when you have a urinary tract infection or a lung infection, we take a sputum, we get your phlegm, and we grow it in culture. Or a urinary tract, we get the urine, we grow it in culture, and then we see what bacteria goes, and then what antibiotics would work or not. Same thing here now with the cancer. We can actually have a better targeted effect and more success by picking drugs or natural therapies that the patient responds to versus just doing a shotgun approach, which is kind of what the conventional system has been doing. We didn't have these technologies before. But what I want to note is that we want to be using laboratories that are US based. There's a lot of alternative practitioners, a lot of clinics that have people, send their blood to Greece and this and that. And we want things that are validated. People are making real life decisions on what type of treatment they should be using or not. And therefore, there's only 2 or 3 companies that are fully validated that are here that actually do that. Some of them actually are using, that are actually screened and used in primary care clinics, like, for example, at Mayo Clinic. So these are things that we want to look at validated. And over time, there'll be more companies. And hopefully in the future, which we'll see, is that these will be covered by insurance. Unfortunately, right now, they're not, and they're quite expensive. So there's an issue with access and people who can afford it. However, some of these technologies and some of these companies right now, for example, in England, the National Health Service, since it's a universal coverage country, which is what eventually we hope one day we can get, at the end of this year, every person in England will have their annual screening with these type of tests, right? Which saves billions of dollars and saves millions of lives because we can catch it earlier as we see cellular growth, on a circulating tumor cell rather than on a pathology of a mammogram or colonoscopy, or we actually feel a lump or a bump.